Hello, I am Dr. Zigmond Kozicki. Everybody calls me Ziggy. The reason that I'm here is to share this presentation with you. Thanks everybody for coming. I want to talk about public health policy, and in particular the changes that have taken place because of the Tax Cut and Jobs Act. This was a law that was passed in 2017. And primarily, it was a Republican plan. There were no Democrats who voted for it. So what did this law do? Well, for one thing, it had a direct effect on hospitals. And in particular, it's going to have an effect on closing hospitals throughout Michigan and throughout the United States. So let's take a look at this. The Tax Cut and Job Act of 2017 is going to result in less money for government programs. And not just for now, but for the foreseeable future. Healthcare service providers can expect less money and probably sicker patients because of it. So it's going to make America sick again. So let's take a look at some of the things that people have said about it even before it was passed. Most of the Michigan hospital leaders have looked at this as something they opposed. And you can see the list here. Michigan State Medical Society, American Medical Association, American Health Insurance Plans, Blue Cross and Blue Shield, AARP, National Association of Independent Business, and the United States Conference of Catholic Bishops. They all said it's a terrible plan because they could see what it was going to do. So the Tax Cut and Jobs Act is expected to lead to 13 million Americans dropping their health insurance coverage. And for Michigan, this means that there are going to be many more people without health insurance. Medicare is the nation's largest insurer. And the cuts that are going to come as a result of this tax cut are going to be seen in Medicare. They have to balance the budget. They just added $1.47 trillion to the national debt, which is around $21 trillion. And there's only three places you can get money to balance the budget: the military budget, Social Security, or Medicare. And Paul Ryan, who is the current leader of the Republican Party and the Congressional House, has basically said the cuts are going to come in Medicare. He had proposed $25 to $50 billion in cuts each year, starting with this year. They're holding back this year because it's an election year. But those things are coming. The effect on hospitals, particularly those that treat low-income patients, is going to be devastating. So when we look at vulnerability index, rural hospital closures are probably most likely to take place because they're the ones that are most at risk. And you can see it on this chart here that some states, particularly down in the south, are going to get hit harder than others. Most of the hospitals that will close in red states. These are states that the Republicans have supported. So in Michigan, there are 35 hospitals currently that have less than 100 staff beds. These are small hospitals. They're vulnerable. In the United States, we have about 3,976 hospitals in total. In Michigan, there's 105 hospitals that are short-term acute care facilities. And so many of these smaller acute care facilities are economically stressed, as well as some urban hospitals, and they're going to feel the pressure. And so when we look at the actual effect here, what we're looking at is a distribution of revenue by patient days in these hospitals. And you can see it's skewed in such a way that there are very few hospitals down on the far end there that are doing well, and many hospitals down on this end who are really struggling. And so it's a negatively skewed situation in the state, which means that many hospitals, and we figure about 54, are already struggling. 26 are actually losing money. So if we look at this from a standpoint of across the United States, you can say here are hospitals that are possibly vulnerable for closing across the U.S. In Michigan, about 35 are most likely in that category. It could be higher, and these are hospitals with 100 or less beds. Some of the rural hospitals in Michigan probably will survive because their parent companies are willing to carry their debt, but not all of them. So if we look at the number of hospitals who have a return of investment of 2% or less, what we're looking at is all of these hospitals in the red area, 54 hospitals that are at risk. If we look at sound hospitals, there's 25 of them. There's 13 hospitals that are also stressed. They could go either way. We could end up with 25 hospitals in Michigan to support all of the patients that are here. Now, what's the effect of that? Well, in urban areas, there's 36 hospitals at risk of closing. In the rural areas, there's 18 that are at risk of closing. Many of these rural hospitals provide the only care for those people. And you might think, well, people will just go to these larger urban hospitals. The problem with that is if you're in an ambulance for more than 60 minutes after a stroke or after a heart attack and you arrive someplace, you've missed that golden hour, that opportunity to be treated, and you're probably going to have much more severe illness and possible death as a result of that. So if the 54 at-risk Michigan hospitals close, what we're going to see is a shift of patient days from those hospitals to the existing hospitals. 1,832,268 days of service have to be shifted from these hospitals that are essentially now closing to the existing ones. What does that mean to you and I? We're going to stand in line longer. We're going to wait longer for lab results, to see primary care physicians, for MRIs, whatever, because there's more people going to fewer facilities. And people who are having to drive a long distance from a rural area to get to an urban hospital or to a rural center are going to find themselves spending a lot of time in the car going to and from appointments. So if we look at Michigan hospital centers, this is what it could look like in the future. This map really shows what might be the remaining hospitals on the map if we don't do something about this. And you can see if you live in the rural area, for instance, the 4th Congressional District, which is this region right here, there's only a few hospitals that will be left to service all those people. So 750,000 or 1 million people will be serviced by maybe 3 or 4 facilities, which is really difficult. So all these hospitals that are in red are the ones that we've identified at risk of possibly being closed. If you want a list of these hospitals, write to me, ziggykozicki@gmail.com. That's ZIGGYKOZICKI@gmail.com. I'll send you this list. But let's go on. What can we do to prevent these closures? Well, that's really the most important thing to focus on right now. Prevent these closures should be the highest priority for anybody who represents you in U.S. Congress. Rewrite the Tax Cut and Jobs Act. It's got to be rewritten. They spent 2 weeks on it. They threw it together. They threw it out there. We need to spend a lengthy period of time in regular congressional process weighing the advantages and disadvantages of all the things in the tax plan, and probably carving out Medicare in particular and making sure that it doesn't get lost in the process and that these hospitals are adequately funded through Medicare and through other sources. We need population health programs in these smaller hospitals and some of the larger ones to replace the acute care model they have. These population health centers would be doing much more preventive work. The revenue stream for them could come through the Affordable Care Act or new appropriations by Congress. We need to do more evidence-based medicine and other things like that. So when we go back to that list, we need to subsidize the at-risk hospitals. We need to invest more in medical research. We need to increase telemedicine programs, centralized tracking of shared data. Primary care and ACO models need to be further developed. Accountable care organizations, which are primary care driven and supported by Medicare, would be outstanding examples of providing primary care in many communities, both urban and rural, that we can do. ACOs are groups of doctors and hospitals that work together and really coordinate high quality care. We could increase community taxes. Well, obviously, if there's not going to be any money coming from the federal government or the state government, then community taxing is going to take place. This is how acute care hospitals used to run. There used to be a levy. We may have to go back to that because there's not going to be enough money to keep these facilities running. And Medicare for all. Medicare for all is a potential solution. And here's a way we could do that. We could offer Medicare to people 55 and older. In other words, bring it down from 65, where it is now, to age 55, and take into consideration all the people who are most likely to be using health care. And as a child is born, each child is automatically enrolled in Medicare. So what we'll have is eventually all of the young people getting Medicare and people at 55 getting Medicare. Now, if we want to move it down to 45 or 35 or 25 or 15, whatever, that's something that Congress can also do over time. But incrementally, we get everybody covered under Medicare until Medicare for all is the case. That might take some time, but it's a big industry, a $3 trillion industry. We need to be effectively working with all of the shareholders in this to make that transformation. So if we go to the next slide, what can you do in your community? Well, here it is. Form a community hospital advisory group of local people. Identify people in the community who work at that hospital. Get them involved with you. Identify local business people who depend on the hospital for revenue. They've got a stake in the process. Develop a media team for messaging and ongoing information sharing. Contact the local public health department to share your concern. Contact similar community hospital advisory groups and work together. Form coalitions. Approach the hospital governing board to be placed on their agenda. Start talking to your fiduciary responsible persons on the governing board of your hospital. Approach the local government and ask to be placed on their agenda. Start talking to county commissioners, city commissioners, whatever it is, and start talking to them about saving the hospital or converting it to a population health center. Partner with the public health agencies to promote these population health programs. Get them to start pivoting towards the idea that they're going to be players in the population health center model. Explore transition away from that acute care model to create these chronic care centers, which now have population health as well as chronic care patients being treated effectively. Partner with rural health clinics, many of which provide free care. Rural health clinics often serve Medicare and Medicaid patients. Increase the use of technology to increase a robust telemedicine program, which makes it possible for people to actually have visits with doctors, nurses, etc. from their home remotely. Begin exploring the creation of a hospital levy or millage in your community. Will your community come out and support it? Will they vote for a levy? If it means that's necessary, then that might be what has to be done. Secure first responder services to ensure reliable and timely EMS. You want to make sure that you don't lose your ambulance service, you don't lose your EMS service. Coordinate patient care with federally qualified healthcare centers. These are located around the United States, and they have the backing of the federal government in terms of resources and money. Encourage the Michigan legislature to provide adequate funding for first responders and to keep Medicaid funding robust so people who are on Medicaid can continue to get health care services. Instruct the U.S. congressman in your district to revise and rewrite that tax law. And in the particular cases, look at the voting record of those congressmen. If they voted for this tax plan, vote them out, because they weren't thinking about you when they voted for this tax plan. They obviously didn't consider your needs. And then vote for people who support community hospitals and community health services. Put people in place of these people who don't care. Elect new people who actually understand that people first makes all the sense in the world. If you do that, then you can save your hospital, and you're probably going to end up with a potential of keeping your community together. Because keep this in mind, if your community hospital closes, if it goes out of business, it's probably one of the largest employers in your community. Your community is going to start falling apart economically. People are going to move away, primary doctors are going to leave, the school system is going to find that the number of students enrolled is going to decrease, businesses are going to shutter, and your community is going to become a ghost town. It's going to blow away. Just like the old communities that used to live along railroad stations. Once the train didn't stop there anymore, those communities evaporated. They disappeared into the mist. They no longer exist. Your community will be lost unless you fight for your community hospital. Help me to help you save your community hospital. Hi, I'm Dr. Ziggy Kozicki, and if you want to write to me, ziggykozicki@gmail.com. thank you so much for listening to this. Share this with your friends and make sure that you vote in the primary election in August and in the election to elect U.S. Congress again in November. Thank you.